Hi, Dr. Mark Agresti. I want to do a video on Subutex, Suboxone, opiates, dependency, withdrawal. What's an opiate? An opiate is basically a drug that affects the same receptors as heroin. And what are some common names for opiates? Oxycontin, roxycodone, Percocet, Percodan, hydrocodone, hydrocodone, methadone, fentanyl, carfentanyl, heroin, morphine, and derivatives of that. They're all brand names out there like Doralgesic patch, meperidine is another one, Demerol. So they're all drugs that they're used to treat pain. They're also highly addictive and they cause euphoria. The pain effects usually last for about 5 days. After 5 days on these medicines, I really think they're not that good for pain anymore. You may think they're treating your pain, but in reality, I don't think they offer significant pain relief. But they become addicting within 5 days. And there are drugs out there that are used to detox from them, prevent cravings from them, called Subutex and Suboxone. Basically the chemical name is Buprenorphine. That's what Subutex is. And the other drug is buprenorphine with naloxone. That's what Suboxone is. So you've also heard about methadone. Methadone is a pure opiate, and it's similar to all the other opiates, but it just lasts a long time and maybe is not associated with as much of a high. And it's used to block the cravings or prevent people from going out and using opiates. There are methadone clinics, and you take it once a day. It's usually in a liquid form or it can be in Sol tabs. I'm not a fan. Okay, so let's say you are dependent on opiates. What does that mean? Different opiates cause different types of dependency. For example, certain opiates like Dilaudid, that opiate only lasts 2 hours in your system. So within 5 half-lives, which is 2 hours, 10 hours, 12 hours, it's out of your system, you'll test totally clean. Methadone can last up to 60 hours in your system. It takes maybe 5 to 10, maybe more days for that to leave your system. Drugs like carfentanyl leave your system in maybe 2 hours, 2.5 hours. But the standard opiate leaves your system in a day. It has a half-life, which means the rate of metabolism by your body of about 4 hours. So drugs like oxycodone, hydrocodone, Percodan, Percocet, hydrocodone, take about a day to leave your system. So yesterday I had a patient come in my office and he says, I'm addicted to oxycodone. He's buying it on the street, roxycodone, which is oxycodone. And I said, what's your dose? And the average dose in this office is between 150 milligrams and 300 milligrams of oxycodone. So I said to him, what happened? And he told me, well, a friend gave me Subutex, which is buprenorphine. And I said, what happened? He said, well, I took it, and I said, let me guess, you got really sick. He said, yeah, that's why I'm here. And I said, well, this is what happened. When you're on hydrocodone or oxycodone, he was on oxycodone, you have a drug level in your system. And let's pretend my hand here, I don't want to make it too dramatic, but my hand is the receptor, and this hand is the oxycodone. Well, oxycodone comes to the receptor, it latches on and stimulates it a lot. But it doesn't grab on hard, and it doesn't hold on tight. It just stimulates it. Now, buprenorphine, which is Subutex, what it does, it latches on really hard to the receptor. It kicks the opiate off the receptor. What does that mean? It throws him into withdrawal because Subutex barely stimulates the receptor. So my hand is the drug here, and this would be the receptor. Hello. So Subutex kicks off the opiate, but does not stimulate the receptor. So what happens is it has a high affinity for the receptor, kicks off the opiate, but doesn't stimulate it. There's some strange qualities to buprenorphine, Subutex, and its sister drug, buprenorphine with naloxone, which is Suboxone. And all that does is prevent you from injecting it. If you take them both orally, they're both the same. The only thing that Suboxone is different with is that if you shoot it in your veins, it puts you into withdrawal and prevents IV use of buprenorphine. So now we're talking about buprenorphine, and if you are on opiates and you take buprenorphine, it'll put you into immediate withdrawal because it kicks the opiate off the receptor. Let's say you're taking oxycodone, it kicks it off the opiate receptor, puts you in immediate withdrawal, makes you sick as a dog. This person that was here yesterday, he was dying. He's sweating, he's shivering, he's got diarrhea, he's got cold and hot sweats, he's got little goose flesh and his hair's sticking up, and he's hypersalivation and tearing, and he's miserable in pain, his joints are aching, he can't eat, he's nauseous, he wants to throw up. He's in acute opiate withdrawal. And I said the reason you're in opiate withdrawal, as I said before, is because you took the Subutex while taking an opiate. Now, what's the special qualities of the buprenorphine? It affects the 3 types of opiate receptors. The delta, it stimulates. The mu, which is the one that gets you high and makes you feel warm and fuzzy, it stimulates that one, but not that good. That's why it's not that much of a drug of abuse. And the kappa. The kappa receptor is unique that, unlike other opiates, buprenorphine blocks it. So it stimulates 2 of the opiate receptors and blocks the 3rd one, the kappa. Now, what does that mean? That means it's a partial opiate stimulator and blocker, agonist, antagonist. And that's why you really can't overdose on buprenorphine, no matter how much you take, because it basically will block the respiratory depression. I have not heard of an overdose on buprenorphine. Does not really cause a high. I've given it to many people over the past 10 years. I have not seen anyone really tell me it causes a high. Now, I have heard on the street, if you shoot it IV, it can cause a high. Minimal, not a good one. But people do use it on the street to come off opiates. So we have that little discussion. How is it used practically? Well, now, if someone comes in and they're on opiates and they want to come off, what I tell them is we have to have a washout period. You need at least 24 to 36 hours if you're on the standard opiates, oxycodone, hydrocodone, codone, heroin. You need to test clean from the opiate, then you take the Subutex. It's roughly for every 300 milligrams of opiate, you need 32 milligrams of buprenorphine. So if you're on 150 milligrams of Oxycontin or oxycodone, you need 8 milligrams twice a day. If you're on around 60 milligrams of an opiate, maybe you can get away with 4 to 8 milligrams a day of buprenorphine. So anyway, my patient came in yesterday, he was on 150 milligrams of oxycodone. So I said, okay, listen, we can use 8 milligrams twice a day of the buprenorphine. You've already induced your withdrawal. You're already involved with the buprenorphine. So at this point, let me give it to you and see if possibly we can override the withdrawal you're experiencing. It had been, I guess, 12 or 13 hours since his last opiate dose, and he had taken buprenorphine in the past 4 hours. I said, in 12 hours, things will just self-regulate, but here's a little bit more buprenorphine. We'll do 8 milligrams twice a day. Now, the benefit of this individual had been in and out of treatment maybe 10 plus times. He has relapsed over the past 25 to 30 years. Nothing works. And I said, well, this will at least prevent your cravings, prevent your withdrawal. We'll keep you on maintenance buprenorphine and allow you to adopt a healthy lifestyle where you learn the coping skills to deal with life without using drugs or opiates. There are some unique qualities to people who use opiates. They don't like alcohol. The opiate high is so euphoric and such a good high that they really don't drink. What they do like, they like nicotine and tobacco because it potentiates the high, and they like sugar because it potentiates the high. That's why they have such bad teeth, people who use opiates. The opiates cause dry mouth and make you crave sugar and make you want to smoke. Smoking makes you get cavities. Sugar makes you get cavities, and dry mouth makes you get cavities. And being on opiates makes you not want to brush your teeth. So those four things together make people who use opiates have very bad teeth. But the use of the buprenorphine can set someone on a path of stability. He's no longer craving opiates, he's no longer going to withdrawal, and he's comfortable. And he's not getting high. So the buprenorphine is usually given in a tablet that melts on your tongue, or it's given in a strip, a translucent strip that you put on your tongue and it just dissolves. It can be used in an IV form. Paramedics use it to treat pain. Anyway, I've had very good luck giving people opiates who've had taken opiates and giving them buprenorphine, Subutex, and Suboxone to prevent their cravings, to get them on a healthy lifestyle. And I follow them monthly, and they seem to be productive. They're not getting high. They're learning positive coping skills. And after maybe 6 months or a year, I say, okay, you've learned to live healthy now. You're not running on the streets chasing a high, buying opiates, the thrill of scoring, the thrill of getting high, wasting your money, living that addict lifestyle. Now maybe we can taper you off the buprenorphine. It can be very difficult to come off the buprenorphine. Some people just seem to be able to get off in a week or two, and some people it takes months. Some people have a lot of physical withdrawal from it. Nothing major, though. It doesn't seem to affect you. It's more of a psychological withdrawal. You just don't feel well, malaise, uncomfortable, and cravings. So that's kind of the story of the use of buprenorphine to block the cravings for opiate, to use it to help you detox from opiates, the dangers of opiates. I go into depth into opiates, opiate detox, opiate withdrawal, the opiate lifestyle, and the use of buprenorphine in my book, Tales from the Couch, on Amazon.com. Thank you. Dr. Mark Agresti.